Welcome back to the Fearless Females Voice podcast. Today I am joined by my old school friend who I haven't actually seen in 14 years, Asiya Parekh. Asiya was living her life in Leicester, got married and became pregnant. However, 20 weeks into her pregnancy, she was told that her son had some issues with his heart, but the extent of this couldn't be identified at that stage. It wasn't until after he was born she found out that he had multiple complications with his heart and that he only had 2 to 3 months to live. Asiya and her husband Imran kept hope alive, and their son went on to living till his second birthday, which was incredible for them to see. Sadly, he passed away in May 2020 in her arms. On this podcast, Asiya openly talks about her story of raising her son with this condition and what her and her family have been through. It's a rollercoaster of a journey, and Asiya has come such a long way and is able to talk about it and help others who are currently going through it as well. Without further ado, let's get stuck in. Tell me, Asiya, what does being a fearless female mean to you?
Okay, so I've, to be honest, you sent me the question yesterday. I've not really thought about it, but off the top of my head, I would say it's being fearless and you know, being a woman in today's society would, to me, mean building up a certain resilience to certain topics, certain subjects, and also acceptance. So with my story, and you'll hear a bit more about that, you know, as we go on, but it just means to me is we're in a position now where women, you know, we're trying to get to the point where women are equal to men, and so there should be no sort of gender diversity, that's not the right word. There should be no difference between being male or female, especially in, you know, the workforce and things like that, and in a social setting, of course. But I think to try and get there, we need to also acknowledge that we have to be resilient towards the differences that there are at the moment, and be accepting of the fact that change will come as long as we work towards it. And I think that's a big part of building up to become, you know, a fearless female, if you like, to be able to understand all of these different aspects that go into it and work towards change. So yeah, I think, you know, just your general outlook needs to be quite positive, and what you give out, you'll ultimately get back.
Couldn't agree more. That's very well said. Cool. So you touched a bit about your story, so why don't we start there? So why don't you tell us a bit about yourself?
Okay, so I am unfortunately 30 years old, really, really old.
That's now. Not unfortunate. I'm 30 as well. I'm loving life. It's a good age.
Oh my God, I feel so old, honestly. I just feel so old. But, you know, like we were saying, talking about school and stuff, you know, I grew up for some part of my life in Manchester, and we moved to Leicester when I was 7 years old. And then for the rest of, you know, up until now, I've been here, my family's here, friends are here. I got married in Leicester. So I have a husband, and we had a little boy, Yahya. He was born with quite complex congenital heart conditions in 2018. When he was first born, the doctors going back a little bit, when I was pregnant with him at the 20-week scan is when we found out about the complications, that there were complications with his heart, but they didn't know to what extent they'd be, because it's difficult to see them on like an echo scan and stuff. But when he was born, they sort of did their scans. It took a few days. We moved to the Glenfield, and that's where they told us the extent of it. So he had a list of 14 different heart conditions, of which, I mean, a heart condition in general is not curable. It's treatable, but you can never cure any heart condition, really, especially if it's congenital, if you're born with it. And initially we were told that he'd probably survive a couple of months, and that would be that, and actually they couldn't do anything for him. And that time of my life was probably, you know, bar what we've been through this year, but it was probably the most difficult up until that point, because to us, we've always thought, you know, doctors are supposed to be able to fix these things. You know, if you've got a problem, you trust a doctor to be able to fix things for you, and actually it's just not true. You know, a lot of the time doctors can't fix things or cure things, or because actually medicine's not an exact science, it's an opinion-based science. So it's, you know, every doctor you speak to will have a different opinion on what's wrong with you, although you're presenting the same symptoms to them. And we got second opinions, from all over the world, from Great Ormond Street, from Birmingham Children's Hospital, from hospitals in Saudi Arabia, America, Boston, South Africa. We went everywhere to try and get these second opinions, and everybody mainly was of the same view that actually, that he's way too complex for us to even go near. They'd never seen anything like it before, so we've been told before that he's the only one in the world that they've ever known of to have these complex heart conditions. Each of them individually there's names for, and each of them they've seen in other children before, but they've never presented together in one child like they were in Yahya. And we spent lots and lots of time in the hospital at the beginning. I think it was about 5 weeks, and then we finally brought him home. So it was an option between keep him in the hospital on this drug called Prostin, which is a synthetic hormone that they were giving him to keep a particular duct open in his heart to allow blood to flow into his left lung, or to bring him home, see how he fares, kind of thing. But Prostin's not a long-term solution anyway, so we couldn't stay there forever. So we decided that we wanted to bring him home. We wanted, even if it was going to be a short life for him, we wanted him to be able to see his house where we live, meet his family, his friends, who we kind of know and are close with. We wanted him to experience everything that he possibly could in what might have been a very short life. And we decided to bring him home. They were doing sort of weekly checks, so we were going back to the hospital every week for reviews and things. And eventually got to sort of a month old, 2 months old, 3 months old, 4 months old, and we were going sort of every week, every 2 weeks. And every time we went, the doctors were really surprised at how well he was doing. He was putting weight on, he was taking his milk okay, he was, doing everything that a normal, and I say that very loosely, but an average baby would do. And that for them was actually quite surprising. And when he got to the 4-month stage, they offered to do something called a diagnostic cardiac catheter. So that's where they do it's classed as a procedure. It's done in a catheter lab, which is similar to an operating theatre, but it's just for investigation. There's nothing that actually they do while he's there. They just do it via a long line catheter that they insert into one of the main arteries. It's like a fact-finding mission, and they thought, let's do this, let's see if there's anything that we can do, for him moving forward, because he'd surprised them. They thought that he'd sort of last a couple of months and, there's nothing that they could do. But now that he's showing them that he's got the willpower, they're thinking at their side, the least we can do really is try and find out if there is anything that we can do for him. And at 6 months old, he had his first stent, which is also done via a catheter. So it's not like cutting him open or anything like that. It's, done via a catheter. He had that, and his oxygen levels really improved, and he in himself really improved. He started doing a lot more of the things that he should have been doing by that age. So he was, eventually he sat up by himself. He started babbling and started doing all the kinds of things that you'd expect for an average baby to do. And then he got to his first birthday, which for us was an amazing milestone because we never thought that we'd get to see it. And from there, they were really keen to try and see what they could do for him moving forward. So the stent actually did great for him for about 18 months. Just under. And, the stents aren't put in to be able to get you through your whole life. Stents are always there as a temporary solution, if you like, up until something a bit more permanent can be done. And that's the case with sort of everybody who would have a stent. And in January of 2020, so this year, he had his first open heart surgery. And that can, complex congenital heart babies have a procedure which is done in 3 different stages at 3 different points in their life. The first one is usually for babies, again, who are born with congenital heart disease, but are a little bit more on the, I don't know what the right word to use for this is, but are a little bit less complex than what Yahya was. They're done sort of straight after they're born, and then when they get to 1 or 2 years old, and then the last one is when they're about 5 years old. But because of Yahya's complexities, they weren't willing to do anything, but then they were. So we went in for something called a BT shunt, which is where they put a piece of plastic I'm going to call it piping, but it's got a medical term. It's a plastic sort of piece of piping that they put in between your two main arteries to be able to allow for blood flow. They thought they were going to do that, but actually they bypassed that completely and did something called a Glenn shunt, which is the second stage surgery. When they opened him up, during the procedure, they realized that his circulation, to look at firsthand, is better than what they thought on the scans, which for us was brilliant. He missed out one stage of surgery and he'd gone to the second stage. And it's all very, and I'll get into, if you want me to, I'll get into sort of the emotional side of it in a little while, but it's very, the whole thing is really, really scary. And you hope for the best, but when your child's in the operating theatre for 8-9 hours at a time, and you've been told that it should take about 4 or 5 hours, it gets really worrying. So we're sitting there in the hospital, and the hospital was like our second home anyway. The NHS is fantastic, and I'll sing that till my very, very last breath, because they really, really are. But it's it was a really, really worrying time. He came out of the surgery, everything went perfect. They did more than they thought that they were going to do, and he thrived even after that. Got to his second birthday, which was amazing.
Nice.
And then developed, really, really great, developed some complications after that. So it's common for children who go through open heart surgeries to develop something called high pressure in their veins that pump the blood around the rest of the body. And once he developed that, we went back. The doctors were always very good, and they'd see him for absolutely anything. I could just ring his nurse and say, look, this is the situation, can I bring him in to see his consultant? And Greg would see him for absolutely anything, from a simple cough, cold, to anything that was a bit more serious. He'd just go, yeah, bring him in, no problem. And I took him in, and they were of the view that actually he's built up this high pressure, so the operation hasn't worked maybe as best as they thought it could do, and to get him through to the next stage, to allow for him to progress even further, they'd have to go back and open him up again. This was at the end of March, where they did another diagnostic cardiac catheter. They always tend to do these diagnostic ones beforehand to just make sure that nothing's changed and everything's as it seems on the scans. And they thought that, okay, we need to be able to take him into surgery as a matter of urgency. But COVID had hit at the end of March, and
Yes.
Glenfield's ICU unit, PICU, which is usually used for pediatric patients, was being used for COVID. All their ventilators, the space, everything was being used for COVID. So we were told that we'd have to go to Birmingham Children's Hospital. We've never been there before. We've only ever met one doctor from there, and that was right at the beginning when we wanted a second opinion. And the whole thing was really, really scary, because you build a relationship with doctors and nurses at a facility where you are, and when you don't have that you're putting your child's life into the hands of absolute strangers. The Glenfield, as much as we have a relationship, at the beginning we didn't, so they were strangers then as well. But that, it's going backwards when you go to somewhere like Birmingham, where we've got no friends, no family support, everyone's here, and we've got to take our child. And in all of this, only one of us could go. So
Because of COVID?
Because of COVID, to try and minimize the footfall into the hospital, they were only allowing for children to go in with one parent as opposed to two parents. But it's a bit of a catch-22, because there was no way that I wasn't going to go, but there's no way that I can cope alone either. And it's very difficult in that, because me and Imran's my other half, by the way. He's very logical, and he thinks with his head more than he does with his heart, and I'm the complete opposite. So I bring emotion into everything, and logic follows afterwards. But because we're opposites, we balance each other out quite nicely. And I didn't have that this time around, because he wasn't allowed to be there. Although he was staying in Birmingham, he just wasn't allowed to be in the hospital with us. And then while we were there, we were told that the mortality rate for this next procedure, mortality rate is the risk factor that they give you as a percentage for anybody going into surgery. So it's for the duration of the surgery and the risk factor for 4 weeks after the surgery. So it's not just in that moment, it's for recovery time as well. And that was given to us as between 10 and 20%, which is actually quite high. 10 and 20% risk of death is what they were saying. And in January, it was between 5 and 10%. And for Yahya, that was actually really quite low. When he was first born, and when they told us that, you know, if they could have done a surgery, the likelihood of him surviving would be about 40%. So coming from that to 5 to 10%, you know, is a big difference. But now we're only, you know, sort of 3 months after the initial surgery, and we're looking at double the risk. And we just weren't happy with it, because we thought, well, you know, I can't put him on an operating table for that amount of risk, when actually we could try and see what the other options might be. That discussion was on Wednesday, the 15th of April, and my dad passed away on the Thursday, the 16th, so the day after we had that discussion. And bearing in mind we're in Birmingham.
But that was all of a sudden, or is that something that... Oh, wow.
Yeah, all of a sudden. So he'd had a heart attack in February of this year, but he was recovering fine. They'd put in a stent, and, you know, he was doing okay, no complaints of pain or anything, but he had a second heart attack, and unfortunately it was fatal. So we're in Birmingham, my child's in the hospital, and then Imran comes into the hospital, you know, where he shouldn't be, but you can't give a person news like that over the phone. So he comes into the hospital, tells me, you know, this is what's happened, and the initial shock of it. And I have something called PTSD, post-traumatic stress disorder, which affects my ability to be able to process information without having certain symptoms off the back of it. So
when did you develop that? Is that something that comes...
Since Yahya was born, because of the amount of stress that comes with, you know, having a child who's poorly, you can, because you're so focused on trying to continue and carry on as normal as possible, you can develop PTSD where you don't realize it, but it's there lingering in the background, and anything that gives you the same amount of stress will then trigger those symptoms again. So with me, I have sort of 2 or 3 different things that happen, where I get I get really sick to the point where even if I've not eaten, I have to throw up. I faint, and I also have flashbacks, like really vivid flashbacks. So in the moment when Imran told me, I think I must have passed out, because I don't remember anything afterwards. And then, you know, I said to him, I have to go and be sick. So I was sick. And then I'm in a situation where I've got a child in the hospital, and my dad's just passed away. We're in the middle of COVID. So actually my mum can't even have support from other people, because we don't live in the same house. But, you know, in that situation, I think there has to be some sort of middle ground, where as long as we're careful, we kind of went in, we comfort, you know, you need each other, and that's just the bottom line. And as Muslims, you know, we try and get through the burial process as quickly as possible. So Dad was buried 2 days after he passed away. So on the Saturday, he was buried on the 18th.
And you'd gone back to Leicester at this point, or were you still in Birmingham?
No, I'd gone back to Leicester. So I spoke to Catherine, who was Yahya's nurse, on the phone, and I said, look, this is the situation. This is what's happened. I have to be able to get back, but I'm not going back unless you can promise me that Yahya's going to follow. So Imran will stay with him, and either you have him discharged and we take him home for the time being, or you get him a bed at Leicester. And, you know, because we're in a process of limbo at the minute anyway, with wanting to decide what we're going to do for him moving forward. And, you know, Catherine's absolutely brilliant, and I'll sing her praises
Catherine
forever,
is...
because Yahya's nurse.
Right, okay.
She was his liaison nurse. So everybody gets assigned a specific nurse, especially more complex patients, to be able to liaise between us and the doctors, should we ever need it. So we have like her work mobile number and things like that, to be able to speak to her if we need to for anything. So I rang her, told her what the situation was, and, you know, she said to me, give me an hour, I'll get him there as quickly as I possibly can. And lo and behold, she did. You know, she had him discharged for home, and Imran followed later that evening. I got back to Leicester fairly quickly, you know, was with my mum and my family for that duration of time. Yahya got back, but it's we were in a process of limbo anyway, where we needed to decide what we wanted to do for him, but you second guess yourself because you think that you're not in the right frame of mind to be able to make a decision of that scale. You know, it's not just, you know, we're not just talking about, oh, shall I give him some paracetamol? It's making a life or death kind of decision. And it's great that the hospital have always been very good with us, with, you know, giving us as much time as we need within reason, making sure that we're comfortable and we have all the information that we could possibly take in to be able to make the decision that would be in his best interest. So another thing that goes with all of this is it's easy to be selfish, isn't it? So you can make a decision because that's what you want, or you can make a decision because that's what you know is best for somebody else. And when it's your own child, no matter how much you want to make the decision that you would want to make for you, you can't do that, because if that was the case, I want him to survive, I want him to live, so I would have wanted to put him on the operating table at a 20% risk. But is that good for him? Probably not, because something huge that I missed out right at the beginning is that when Yahya was born, before Yahya was born, my dad said something to me that I lived and breathed by for 2 years, and that's, whatever you decide, make sure it's in his best interest and not in your best interest. And whatever you do, don't make him suffer for your own selfish gain. You know, to try and keep him here with you, don't make him suffer to the point where it's not a life for him. So the risk factor was risk of death, but then there's a whole host of other factors that come with it, where, you know, severe internal bleeding, brain damage for life, etc., etc. And that's what I mean by don't make him suffer, because there's no point in me trying to keep him alive to be with me when he's not going to be able to experience any of the other things that come with having a good life. And even if it's short, somebody can still make the most of being here. And, you know, and my dad's voice rings in my ears a lot, and it always has done, because he was always very good at being logical. And I think that's where Imran comes in, and he's a great support for me, because actually they're both the same. You know, Imran's very logical as well, and my dad always was.
Similar characteristics. It's nice.
Yeah, exactly that. And so, you know, we went back to see his consultant the following week after my dad passed away, and we decided that actually, you know, after having lengthy discussions and taking time over the weekend to think about it, we decided that actually an operation was the best way forward, because the other two options were to do nothing, and he would eventually get worse and worse and worse and pass away. Or we could go back and have a stent put in, but within sort of a month or so of that stent being there, we'd be back in the same position. And at that point, they would refuse surgery anyway. So the only logical thing for us was to have the surgery, you know, at 20% risk, and we were still worried about that, but actually it gave him a fighting chance where none of the others did. And, you know, we sort of spoke to the consultant, we booked in to go back to Birmingham for the surgery, because we were still in the height of COVID and Glenfield wasn't available. And during those few weeks while we were waiting for a date, Yahya progressively got worse. So I started noticing things like the veins around his sort of chest. Sorry, if any of this is too graphic, then just tell me.
Go ahead.
The veins around his sort of chest area were, because of the high pressures, they were bulging out quite a bit, and you could see them on the surface of the skin where you're not supposed to be able to see them. He started sort of, you know, being completely withdrawn, wasn't interested in anything, would just sleep, he wasn't eating. So I rang Catherine, as you know, I did in any situation, and I said, look, I'm noticing these things. Can I bring him in to see Greg, because I'm starting to get really concerned? And she was like, yeah, bring him in. Greg saw him and said, I think he's got an infection of some sort. I can't figure out what it is, but we'll start him on a course of antibiotics. He took blood, etc. And he said, on Monday, I'll give you a ring to see what the blood markers are doing, the infection markers, and we'll go from there. He rang me on Monday and said, they're supposed to sit at like 4 or 5, and they're sitting at between 60 and 70, so really high. You're going to need to bring him in so we can start IV antibiotics, and he'll have to be admitted. So fine. they did another blood test, and the following day it'd gone up to 140, the infection marker. So it was just it was doubling down. You know, every day it was double what it was the day before, and he couldn't figure out, you know, what was going on. So he sent us for an MRI of the head and the chest to try and see if there was any signs of blood clots. And that MRI came back almost straight away, and he had quite severe blood clots in his head and in his chest on the right side. And at this point now, you know, we're getting into dangerous territory where they need to be able, with blood clots, you have to be able to act really fast to get them to dissolve, but we don't know how long they've been there, because the MRI was done and that's where they've been found. But to the extent that they would have had to have been there for a while. So they started him on heparin, which is a hospital grade sort of blood thinning medicine. Started him on that, you know, admitted, kept him in, and all through this, we're kind of, only one parent is allowed. So I was in the hospital, and when I needed sort of one day to recharge, I'd come back home and swap out with Imran. So we were allowed to swap because our situation was a bit more dire than what would be expected, but usually you wouldn't be allowed. And then on sort of a week, I'd say a week, I think it was about 3-4 days of being in the hospital, his saturation levels, his oxygen levels dropped very suddenly. So they were sitting in between 60 and 70, which for him was very normal. But they were dropping down to the 30s, which, you know, is half of what they were. And if you've got a functioning circulation, you know, a normal circulation, they should sit at between 98 and 100%. But his are sitting at 30, which is really dangerous. So they quickly sort of move us to put him on oxygen, move us to the high dependency unit at the Royal. And from there, everything just kind of went downhill. I mean, you know, they started him on really high pressurized oxygen on a machine called CPAP, which you wear a mask that is suctioned to your face, where there's no room for any air to get in, so it's completely pressurized. Mm-hmm. And what it's supposed to do is force the oxygen in rather than just nasal cannulas or a normal oxygen mask, to be able to get his lungs, take the pressure off his lungs doing all the work of oxygenating the blood.
Okay.
So they put him on that, and they sedated him with things like ketamine, and really high sort of doses of drugs to be able to keep him completely still, because Yahya was a very, I don't know what the right word is. He was a very strong-willed child, where if you're doing something to him that he doesn't like, he's going to let you know that he doesn't like it, and that's the end of it, you know? Mm-hmm. And he's being given ketamine, which is, you know, used as a recreational drug as well, but, you know, medicinal doses of ketamine, where you're giving him this and it's supposed to sedate him, but actually he's so uncomfortable that he's trying to fight the mask off while he's on ketamine. So for us, that's kind of like, you know, going back to my point from before, where we just wanted him to be comfortable, and that was it. Like, no matter what it was, as long as he's comfortable, as long as we feel like we're not making him suffer without reason, then, you know, that's fine. But if he's showing signs of being this uncomfortable, then something needs to be done about that, as far as we're concerned. And, you know, we had at this point really extensive conversations with consultants, surgeons, you know, intensivists from the ICU about what to do moving forward. And everybody was of the same opinion that actually there's nothing that we can do at this point. You know, there's an option to give him something called alteplase, which is a clot busting drug, but it means that the dose has to be very specific to be able to avoid a big brain bleed. And if he has a brain bleed, it's going to be severe. He's going to be in ICU, you know, forever. At some point they'd have to turn machines off and things like that. Or we leave him as he is and see how he fares, and we can go from there. And for us, the big brain bleed thing was, you know, no alteplase, because that again to us is, you know, and everybody will have a different view on what they might do in this situation. But for us, it's a big thing to be able, you know, to you give him something of that drastic effect, and if something happens, are you going to be able to live with yourself? That's the point. And for us, we knew that we wouldn't be able to live with ourselves, and so we decided against it. We just thought, as long as you can keep him comfortable, we're fine. So what they did is they took off this CPAP, pressurized oxygen, and they gave him vapotherm instead, which is nasal cannulas with high pressurized oxygen again, but it just doesn't sit with a big mask on that's, you know, wrapped around his head to the point where he's becoming so puffy because everything's swelling up from this pressure. And he's on, you know, IV fluids, and fluids generally with babies, in babies who have heart conditions, can make children very puffy anyway. So they put him on vapotherm, and at this point we're allowed to stay with him. Both of us are allowed to stay with him, because what they would class it as would be end of life care. And you know, we, as much as you listen to the doctors, I think what got us through the 2 years of, you know, them telling us one thing and actually something completely opposite happening every time, was that, you know, the doctor's job is to give you worst case scenario, and that's perfectly okay because that's what they're trained to do. But your job as a parent is to fight your child's corner. And he can't do it for himself. He can't sit there and say to the doctors that, you know, no, actually, this is what I want, so we have to do it for him. And, you know, we're very big believers in whatever's going to happen is going to happen regardless of how much you worry about it or how much you stress about it. It doesn't take the worry away, but I don't think you can live your life if there's no hope. Hope is a really big thing, isn't there? If you have no sort of view of what the future might be like, or no hope of surviving a certain situation, then you've given up. And at that point, there's nothing nobody can do for you because you don't want to help yourself. And that's what it is, isn't it? And yeah, I mean, you know, he was on the high dependency unit, and within sort of 2 or 3 days after that initial conversation with the doctors, on the morning of the 12th of May, the nurse said to me, oh, you know, once you've had your breakfast, we'll change his bed sheets, give him a wash, that kind of thing. So I was always very keen on doing everything for him and having the nurse do as little as possible because I'm his mum, you know, and I felt very like, you feel helpless in that situation because actually you can't physically do anything for him medically, so you want to do everything else that you can possibly do to make up for it. So, you know, I gave him his wash, changed his nappy, did the rest of it, and the nurse said, take him over to you, sit on the bed, and I'll change his bed sheets. So I went, okay. And the minute I'd not picked him up on the Monday because I thought I don't want to keep bothering him because he's clearly uncomfortable. You know, when he was being touched and poked and prodded, he was just really uncomfortable. So I didn't want to add to that because, you know, they want to take bloods every 5 minutes and they want to do this, that, and the other and poke him. And I just thought, if he's resting, that's fine. And I picked him up and I sat down on Tuesday the 12th, and this was probably at about 12:30ish in the afternoon. And the minute I sat down with him, his breathing changed. And I said to him, man, his breathing's changed. And I said to the nurse, I need a doctor, his breathing's changed, because it was deep and short breaths, not like usual calm breaths. And she went to go and get a doctor. The doctor's come in with his stethoscope, listened, and he turned around and he said to me and Imran, I think this is it now. And at that point, I'm holding him, and, you know, we're praying and we're doing everything that we possibly could do, you know, without having medicine keep him alive, basically. We discussed it with the nurses and the doctors beforehand to say that actually if he starts going by himself, then we don't want for resuscitation, because that's him deciding, isn't it? It's not, we're not switching off machines, but that's him deciding to say, I've had enough now, I can't do any more now, you know. And his breathing changed, and the nurse turned around and she said to me, do you want me to begin resuscitation? And I said no. And we're holding him, we're just holding him, and, you know, within sort of a minute, very peacefully, he's in my arms and he's kind of just passed away. And I don't really remember anything after that again. Imran says that I passed out, so you know, I'm not sure whether I did or whether maybe I just blacked out or I've got loss of memory or PTSD or what around there. But, you know, when I came back to reality, if you like, I remember the first thing I said to Imran was, what am I going to do tomorrow? Like, when I wake up in the morning tomorrow, what am I going to do? And he looked at me confused and he said, what do you mean? I go, well, usually I would wake up in the morning and, you know, I'd go to Yahia's room and go and grab him and change his nappy and brush his teeth and give him, you know, a wash and stuff. So when I wake up tomorrow morning, what am I going to do? And he looked at me and he went, don't worry, you know, we'll figure it out together, kind of thing. And I just wanted him to give me an answer, because my whole life for 2 years was Yahya. I quit work. I was at home with him all the time. You know, I made sure he had his medicine on time, his food on time, his hospital appointments on time. You know, literally my whole day was functioned around this little child that I had, and I wouldn't have it any other way. And now that I don't have that, I was confused with what the hell am I going to do tomorrow, you know? And it's a strange thing to, you know, to say and to ask. And looking back on it now, you know, it's very different to how maybe other people might react. But the reason why I bring it up is kind of everybody's different, aren't they? And they no two people will deal with grief in exactly the same way. And I accepted it, but not to the point where I believed it. And, you know, from there, everything was kind of a big blur. All I remember is, you know, Imran being on the phone, you know, sorting things out for with MBCOL, which is the Muslim burial service here. And, you know, with his uncle and with his brother and with my brother. And I'm just sitting there holding my child thinking, what's going on? Because I don't know why. I just, in my head, I just thought, well, why are they making all these phone calls? You know, he's going to wake up in a minute. And it's really strange, but it's where I've accepted it. I know he's not going to wake up, but again, back to the point that I made about hope. If you don't have hope, then you can't survive. And, you know, it's, I think, probably the strangest feeling I've ever had in my life, because I just couldn't make sense, put two and two together and make sense of what was going on, although I knew what was going on. You know, it's difficult to explain, and I probably sound a bit crazy, but it's
no, not at all.
Difficult to, you know, put it into words to get it across. And yeah, I mean, that was kind of, you know, the end of it. We came back home. They kept him at the local masjid where he was to be given his sort of final wash, where Imran and my brother and Imran's brother and everybody went round. You know, it's usually the men who do it for men or boys, and women do it for women. And they went round the next day and did all of that. And they brought him home for us before they took him for burial on the Thursday. And I remember sitting there, you know, and me and Imran had our own little sort of half an hour with him right at the end, you know, and they came to come and take him away. And Muslims are buried wearing white cloth. So he's, you know, his face is open for me to be able to see while he's here. But then when they're taking him, they kind of cover him over again. And the only thing I remember about that day is when they were getting ready to kind of take him to Saffron Lane, to the cemetery, I turned around, you know, I saw them cover his face over, and I went to, I think it was Imran's uncle, and I went, you can't cover his face because he won't be able to breathe. And he looked at me, and Imran looked at me, and he said, you know, it's okay, babe, you know, it's fine. And I went, but you're covering his face, how is he going to breathe? You know, you've got to think. Why can't you think about what you're doing? You know, and I completely lost it at this point. And I had Rashida auntie, who's one of my friend's mums, was there with me because my dad's passed away. My mum has to sit in something called idda, which is where if your husband passes away or you get divorced, a woman isn't supposed to leave the house unless she
For how
absolutely
long?
has to. When your husband passes away, it's 4 months.
Okay.
But when you get divorced, I think it's 3 months. There's a difference. I'm just not sure what it is. But there's a reasoning behind it, which I'm not, if I'm honest, completely sure of. But there's a reasoning behind it. So my mum's sitting in Idda, and when we've asked, an imam from the masjid if she can come, he said that she can, but it's best if she doesn't, to keep in with the religious requirement. And I'm sitting there, and I've lost my dad 3 weeks ago, 3 weeks before this has happened. I've lost my son, and I've got no parents for support, and I'm the oldest of my siblings. And, as great as my sister is and as great as my brother is, I'm not going to take what they're saying, which, and I don't mean this to sound ridiculous, but I'm not going to take what they're saying on board as quickly because they're younger than me. And it's not that I don't value their opinion, it's just that usually I'm the one that people would come to for advice or for support or for a shoulder to cry on. And actually, I'm in this situation where I feel like I've got no one. And
you had your husband there, any other family members?
My sister, my brother were there. We had a few friends there. Rashida auntie, who's one of my best friend's mums, but she's like a mother to me anyway. And I was just about to get on to the point where actually I'm so grateful that she was there, because as much as I want to listen to other people, I find it really difficult. But because I view her in the same light I view my mum, I'm more receptive to what she's saying than I am to maybe what my friends are saying, or what Imran's saying, or whatever it might be. Because in that moment, as much as you think that you might not, but you need a parental figure, it would have been my dad, but he's not here now. And my mum's not there, and Rashida auntie is the only other person really that if ever I need advice on anything, I will phone her. So sometimes over phoning my own mum, because she has a different set of life experiences to what my mum has, and there's certain things where you need one over the other. And it's not because I love my mum any less, it's just because I think her life experiences will suit this situation better.
Makes sense.
And honestly, I don't think I could have functioned without her for the next sort of few weeks. And even up until now, if I'm in a state where I can't get my head around it, I'll just go there, or I'll ring her, or I'll do something to be able to help myself. Because again, going back to the other point, it's if you don't want to help yourself, then nobody else can help you. And fast forward, what are we, 5 months now since Yahya, and 6 months since my dad. We're okay. We're learning to get along with. I say get along, not that we didn't get along before, but me and Imran are, learning to live just the two of us again, compared to having Yahya here, which you'd think would be easy to do, but actually for 2 years this baby's been both of our whole life, and now he's not here. We have to adjust again to living how we were pre-baby, and it's difficult because what you had and now you don't have it. And it's a very strange feeling, but we live, and that's it. I don't think I can explain it.
You've just sat there and told me such a powerful, emotional story of everything that you've been through for the last 2 years, 3 years. And you sat there and so strong-minded with a kind of positive outlook, and your mindset, no breakdowns, just sharing your story, telling it how it is and what happened. How are you so strong about this? How have you come to where you are now? I literally feel like it's just I've got a really good outlook on this.
If I'm honest, it's it helps me to talk to people about it, because talking's a huge part of trying to heal. Talking's a huge part of grieving. It's a huge part of trying to overcome any sort of mental health difficulties that people might have. And I'm, you know, I'm sure you remember Chenny from school. I'm a talker anyway. I talk your ear off for
It
days.
sure is.
It's something that helps me, and when I speak to other people, and you know, when I share my story, usually it's with the view of supporting the children's hospital that they're trying to build in Leicester. And I'm a parent ambassador for the hospital charity, and sharing Yahya's story is helped me, but also helped the hospital in raising a £250,000, I think we've done so far, with Yahya's story, with another £400,000 pledge to go by the end of this year. They're trying to raise 7.5 million for the hospital, and they're going to have one centralised facility here in Leicester where it's an East Midlands Children's Hospital. So everybody from the East Midlands has got somewhere to go with their own doctors, their own nurses, so not having to go like we did to Birmingham, you know, to people that they trust, and everything under one roof. So if something like a pandemic was to happen again, it would mean that no child would have to go outside of the city to get the medical care that they need, because you can't take a children's hospital away from children. But the Glenfield's ICU unit was needed for COVID, and so that happened because you can go to Birmingham for a children's hospital. Do you see what I mean? So if it's in Leicester, they can't take that particular unit for a pandemic, rather than, you know, and parents don't have to go elsewhere. And you know, I think with the breakdowns, I think everybody is a bit different in terms of how they deal with it and how they process the information. You know, I've met people along my journey along the way who have lost their children, and they deal with it completely different to how I deal with it. But for me, because I talk about it quite a bit, it embeds it in my mind that, you know, this is what's happened and this is how it's happened, and the reason why the how is important is to be able to help the hospital. And you know, now they've said the high dependency unit at the new children's hospital in Leicester will be in memory of Yahya, which is amazing, because
that's incredible.
We'd never, ever, ever been to high dependency before, but that's where he spent his final days. And, you know, it's absolutely amazing that even though he's not here and he won't be able to use the facilities like he would have done if he was, but his friends that he's made throughout his little journey, the parents who we've made friends with, you know, at the Glenfield and stuff, their children will still use this facility. And if it's done in memory of a child who was at the Glenfield, used the services of the NHS for 2 years and was very dependent on them to a certain extent, you know, with the absolute fantastic care that we got no matter where we were, is testament really to why it's important. And actually, just because he won't use it now doesn't mean that it's any less important for us to make sure that it's standing.
Of course not. It's going to help so many other children going through this.
Exactly. And, you know, I say it with quite a little bit of pride, actually, because, you know, it's a huge thing to be able to accomplish, and it's a huge amount of money. And when your child's name and your name is attached to something like that, it gives you the feeling of something positive coming out of a situation for us that was actually very negative. You know, it's not a nice experience. I wouldn't wish it on my worst enemy, but actually, because something good is going to come out of it now, means that we can look back on it with pride. We can, you know, share his story to be able to help other people. And that's the main thing, where when we had him, our whole focus was wanting to keep him comfortable, keep him happy, you know, and now that we don't have him doesn't mean that any of the other children are any less important. And, you know, and years ago, before I was a mum to him, I would have never, ever, ever in a million years known about the Glenfield, about the children's hospital that they're trying to build in Leicester, about all the fantastic members of staff that they have. And
I don't know anything about it, so it's really nice that you're highlighting this and sharing this.
And the whole point is that actually, you know, I didn't know about it. I can't expect people just to know about it now that I know, but it's a matter of change. It's a matter of, you know, building awareness, highlighting it to other people to be able to make them aware. And, you know, it's a worthy cause. And actually, if there's something that you can do within your own community, then why not?
I love it. I love the initiative. It's great. What advice would you give to other parents who are going through something similar to what you have? So whether it's a child who has a condition, whether it's a loss of a child before birth, after birth, what would you say to these parents?
I'd say that honestly talk about it. I appreciate that, you know, it's very difficult to do. And in the beginning, I was very sort of not keen, but not wanting to talk about it for the worry of making other people uncomfortable. And, you know, we live in a society still as British Asians where we're more worried about what other people will think or how other people will feel to a certain thing rather than worrying about or caring enough to help ourselves. And I think with mental health and, you know, the huge initiatives around that at the moment, it's really, really important to make sure that you talk about something as much as you want to talk about it, not, you know, as much as somebody else would expect for you to talk about it, or worrying about making somebody else uncomfortable or any of that kind of stuff. You know, if you've got a good circle of friends and actually they are your friends in every sense of the word and your family in every sense of the word, they shouldn't be uncomfortable with you sharing what you've been through. So if you've lost a child, pre-birth, post-birth, an infant, anybody, whatever it might be, a miscarriage, whatever it might be, it's really, really important to talk, to be able to share your feelings. If you need support and you think professional help might be better, then do that. I've done it. You know, I had postnatal depression after I had Yahya, and I sought support from Let's Talk Wellbeing, which is the NHS counselling service. I had, I think, 6 weeks of therapy with them. I'm currently waiting for an appointment for my trauma therapy, for counselling for that, because it is traumatic. It is. And you know, the more you talk about it, the more you'll be willing to accept it. The more you accept it, the easier it will be for you to continue living on. You know, it's not easy and it's never going to be easy, but it will become less difficult. Not, you know, it's never going to be easy, but it won't be as difficult as it is now.
It's been really nice that you've had your support network as well. You've got a husband there, your family, your friends, as you said, people to talk to. You've had great nurses and people in the hospital who have helped as well throughout your journey with this. So it's been good. So tell me, what's next for you then?
Oh dear, no idea, if I'm honest. I initially thought that I'd get back into work, but I looked and I applied and I did a few bits like that, and I thought, with the pandemic at the minute, it's probably not the best time because everybody's looking for work at the moment. I'm qualified in marketing. My degree is within that field, and at the minute the market is really saturated because people are being made redundant from their jobs, and you know, one job will have an application of over 100 where usually it might have 20 or 30 applicants. So me being out of work, and you know, this is not putting myself down or being negative about it, but me being out of work for 3 years now and not being in the field and maybe not being as current and up to date with what's going on in the field is going to hinder my chances a little bit of getting a job, which is okay, you know, and absolutely it should. If I was an employer, I'd probably look at it in the same way. So rather than sitting there and moping about it, I thought I'll start my own little venture.
I saw this.
Yeah.
Tell us a bit more about it.
Yeah, exactly. And, you know, I make toy boxes for children now, where I do it because I started off, when I was looking for a toy box for Yahya for his first Eid, which, you know, I wanted to buy him one for his toys. And I remember looking and thinking, I don't like any of this stuff, or, you know, this is a bit out of our price range, or whatever it might be. And I thought, I can make one. I'll make one myself. So I got in all the stuff and I made a toy box for him, you know, personalized one with his name on it, and all the rest of it. And I put it up, I think, on my Instagram, and people were like, oh my God, will you make us one? Will you make us one? And I thought, well, why not? And, you know, I thought about doing it for a long time while he was here, but I never actually got around to doing it. And now that I have the time, if you like. I started it back up again, and yeah, it's going well, and I like it because it keeps me focused. You'll remember Channy from school. I was always creative. Textiles art, my bag completely. I love doing it. So I thought, well, it's two things that I like doing and I enjoy doing that I'll put together, and rather than sit around and mope about not having a job, I'll make myself one, and go from there. So that's what I did. But yeah, I do little bits of charity work, like I mentioned, the hospital as a parent ambassador for Leicester Children's Hospital Appeal. And I also do I say I've not done it for a while, but little bits of blogging and YouTubing and stuff. And I've done that for a little while, but I stopped quite a while back, but with the view of getting back into it, hopefully, at some point. But yeah, that's me.
The toy boxes, by the way, they are incredible. I've got a nephew, so my brother's having a baby, which will be born next year. So I was looking into that. I was like, could do with one of those toy boxes as a nice gift for him. So for any of those people who are interested, I'll put a link to your whether your Instagram or social media, just so people can have a look. Definitely say check it out. But it's been a pleasure to have you on this podcast, Asiya. Thank you so much for sharing your story. It's been an emotional ride.
You know what? It's great. It's absolutely great that you've started this little community of people who come together and support each other. And the fact that it's, female-based, led by a female, it's amazing. And, I'm always for women empowerment and, go girls, woo.
I agree. Like there's so many different types of things that as women do. So whether it's career-based, whether it's going into motherhood. So this platform is to raise awareness for all different types of futures, should I say, for females. So,
absolutely. You know what? You've done great with it, and I wish you every success, and I hope it goes amazing.
Thank you so much. Thank you.
It was great talking to you, love.
And you. Thank you so much for listening to the Fearless Females podcast. Be sure to join our Facebook group called Fearless Females and stay tuned for the next episode. Bye for now.